sister Laura, she had keratoconus, and that's when your corneas grow cone-shaped and you're not able to see. She had her first cornea transplant at 19, the second one at 20, and they were both very successful. She went on to have 5 more transplants that were much less successful over the next 40 years. We really thought that her vision problem was going to be her greatest challenge, but boy, were we wrong. Lori was our family memory. She knew everybody's phone number, birthday, telephone number, who we dated and when, and why we broke up. And she would tell anybody. She was an amazing speller. Our mother, if we made a mistake in the spelling, our mother would say, now go look it up. We didn't have to. We had a family spell check. Lori would answer the question, and she always knew the answer. Lori worked at the front desk and as a receptionist at our children's hospital for 26 years. She would amaze families and staff because she always remembered their names. She knew all their family members. She knew what doctor they were coming to see, and even if they only came once or twice a year. As Lori's vision started to fail, she couldn't see people's faces anymore, but she recognized them by their voice and their walk. And she did the same thing for patients, family, and staff. Unfortunately, in 2004, she couldn't read the computer screen and they let her go. And that was a horrible loss because she loved the children at the hospital. In 2009, Lori started having leg pain and shaking. She went to her primary care doctor and he diagnosed her with restless leg syndrome. He told her to start on the Firehouse diet. He sent her to physical therapy 3 times a week and told her to put a bar of soap between her sheets. We changed doctors. And this is my wrong box number 1. Her next primary care physician thought the leg cramps were from her cholesterol medicine. She changed her medicine to Zocor, and then to Crestar, and then to fenofibric without any success. Wrong box number 2. Lori also developed non-infection gastroenteritis colitis. Used her as a steroid medication, controlled it. And we learned last year that this probably was the beginning of the Hashimoto's and that was related to that. In 2013, Lori was referred to a neurologist because she started having her legs would shake and then she'd fall. So we went to see a neurologist. She didn't know what it was. She sent us to one of her partners who specialized in movement disorders, and he ruled out ALS, MS, and Parkinson's. So thankfully, there were boxes 3, 4, and 5 were checked off. In 2016, Lori started having what I called body spasms. She'd be walking around and her whole body would kind of shake and she'd drop to the ground. And both arms and legs would shake in unison. I thought they were seizures. So I made an appointment with the same neurology group and had to wait for 3 months to get an appointment with that neurologist. She also started having visual hallucinations. She would see letters on the TV screen. There'd be like the letter N, and then below it would be a series of words like new, next, never, which was really curious because Lori had a 50-inch color TV, and she couldn't make out the faces of anybody, but yet she would read these words off, and she thought it was really funny that she could do this and I couldn't see the words. We waited 3 months to see that next neurologist. When we got to the doctor's office, he had left the country. So they said, we can give you an appointment with another doctor in 2 months. And I said, no. I'd been a hospital administrator before, and so I used my best persuasion, and we were referred to another neurologist in the group. That neurologist decided that she had muscle memory. Because she was blind in one eye and losing sight in the other eye, that he explained that her brain and her muscles had forgotten how to communicate. So that was wrong box number 6. But he sent us to a physician's assistant in his group that specialized in muscle and movement disorders. She was very good. She did about $6,000 worth of blood work, and she's the one that found that Lori's antibodies were out of whack. Her thyroid globulin was 745.6, and normal was 0.0 to 0.9, and her antithyroid paradoxase was 530. She diagnosed with Lori with Hashimoto's encephalopathy. With box number 7, we finally had an answer. She had said she had treated one patient with HE before, and so we were very hopeful. She started Lori on prednisone, 60 milligrams, and there was no change. She sent her for 5 days of IVIG at our local hospital, and there was no change. She was then out of ideas. So she referred us to Duke University. Called there, got an appointment in 7 months. And so I started looking around for other physicians. My daughter found Dr. I'm going to mess up his name. So nervous. Dr. V at Johns Hopkins. So I applied there, and 3 months later, I got a call that she had an appointment at the akathisia clinic. Well, she didn't have akathisia, she had myoclonus. And by that time, we were already seeing John Snyder at Virginia Commonwealth University in that July. Dr. Snyder had never seen a patient with HE, but he was very kind. He did his homework, and he did his very best. He started Lori on Klonopin and Keppra. There was some improvement in her gait, but by this time, it was very difficult for her to walk. I mean, I could walk with her if I held both hands. She other times had to use a walker. She could no longer hold a glass. She could only eat doing finger food. And she was starting to have cognitive changes too. Our family memory now didn't know the day of the week, didn't know right and left. It was very sad to see the sister that I'd always known kind of slipping away from me. Lori was sleeping 16 to 18 hours a day. And so when I had to go to work, I had the video cameras installed around the house. If she would wake up, unfortunately, she'd try to walk or crawl and she'd get lost in the house. And so in between patients, I would check the video cameras and find her stuck behind the couch or behind the coffee table or in the dining room. And I had 2 wonderful neighbors that I could call, and they would come over and let themselves in, find Lori, get her back to her chair and or her recliner. By October, she couldn't be left alone, and I had to hire aides to be with her while I was at work. The funny visual hallucinations changed to very scary hallucinations very quickly. She thought she was being kidnapped, being held in vans, buses, trucks, boats. She thought that she was in these vans, but they'd be in the Rite Aid parking lot or the Harris Teeter parking lot right near her house, but nobody could see her and nobody would find her. Luckily, she had an iPhone, and so she would frequently call me at work, and sometimes I had to come home to try to calm her down because she was so scared, even with her aide sitting right next to her. It didn't calm her. She was always amazed that I found her. And I said, it's the GPS on your iPhone. You know, that Siri will always help me find you. Unfortunately, it wasn't long before I had to disconnect with Siri because she started calling the police and telling them I was killing her. So she lost her friend Siri, but she still had Alexis. So. She was on psychiatric medications for the hallucinations, but they were of little help since it's autoimmune. Lori loved the beach, so every Sunday, she obviously couldn't walk out on the beach anymore, but every Sunday, even all through the winter, we would go down, have lunch, listen to music, and I would stroll her on the boardwalk, and she could still have her beach. By February, she was sad, crying all the time, and wouldn't leave the house. We had an episode in March where, as I said, to get Lori around, I'd have her get her up, sit her on a rollator, and roll her to the bathroom or to the chairlift or wherever we had to go in the house. I rolled her to the bathroom and got her to stand up, but she couldn't take a step. And I thought she was mad at me. So we rolled back and we tried again, and I said, well, do you want to go up to bed? So I rolled her to the chairlift, thinking she would stand up there. She still couldn't move. So I didn't have any choice but to call 911. So when the paramedics came, Lori was very pleasant to them and told them they were very handsome. She was totally blind at this time, and they didn't know that. They enjoyed the compliment. And they asked her what was wrong with her, and she said she had syphilis, which of course she didn't. My mother was mortified when I told her that. So we took her to the emergency room, and then they admitted her to the hospital, and she had a severe UTI. Unfortunately, with the hallucinations, she thought all the nurses were firemen that she had known when she worked at the children's hospital, and she would call them by name and say, I know you, I know what you did with your wife, I know this and that. They were really thrilled. But thankfully, they weren't the same firemen. But she would fight them and try to pull out her IV and wouldn't let them do blood pressures. So they called for a neurologist. As luck would have it, it was the neurologist on call was the one that said she had muscle memory. So he came in with 10 medical students and 2 residents and a nurse practitioner. Asked Lori some questions. She failed every question on the mental status exam. He never asked her to sit up. He never asked her to stand. He had one medical student lift one leg and drop it. He wrote a note saying that she was oriented in all spheres and needed to be transferred to a rehabilitation center so she could learn to walk. That ship had sailed a long time before that. I was a bit distressed, and I tried to call him and talk to him, and he wouldn't talk to me because I wasn't his patient. I talked to his office manager, and she suggested, since it was a hospital problem, that I call the chief of neurology at the hospital. So I did, and he suggested that I start my sister on a paleo diet and call him back in a month. So within 36 hours from her admission, the charge nurse came to me and said, you need to take her out of here. She's too disruptive. So they didn't even bring the wheelchair. I had her wheelchair there, but nobody escorted us out of the hospital. As we were leaving, the nurse said, are you going to be okay? And I said, what choice do I have? And I had to take her home. So a month later, I had to admit my sister to a memory care center, which was the hardest thing I've ever done. The hallucinations were getting worse. She would only sleep 2 to 4 hours, and she'd be up all night. She wouldn't sleep in her bed. She thought it was a tractor-trailer truck that I was putting her in, and then I was going to park it in the middle of the highway, and she'd be killed. So she would scoot around the house, and she wouldn't go upstairs anymore either. So we both had to sleep downstairs, and she would scoot around the house. So I had to admit her to a memory care. I visited 6 facilities and found what I thought was a good one, 10 minutes from my office, so that I could visit her every day. Oftentimes I went twice a day. What I did not know until after I got her records after her death is that despite my explaining Hashimoto's encephalopathy to the nurse, all her records from her primary care doctor, her psychiatrist, and her neurologist all said HE. This nurse changed her diagnosis to bipolar disorder 3 days before she was admitted. I saw the bipolar once on the MAR, and I questioned it, and she said, oh, yeah, we know she doesn't have bipolar. It's just because of the kind of medicine she's on. And that was a very big wrong box, number 10, with bipolar. What looked like a professional caring and home-like facility was not. Lori was 20 years younger than everybody there, and most of the ladies were happy to just sit and rock their babies. Lori wasn't. She was confused and frightened by the continuing hallucinations. She just wanted to go home, but she didn't know where home was. 53 days after admission, the nurse and the administrator asked for the first care conference. And they asked that Lori be transferred to a geriatric psychiatric hospital. Despite explaining that her condition was Hashimoto's and an autoimmune disease, not psychiatric, they didn't want to know. And they didn't want to understand. So again, I searched for another memory care facility. My mother was visiting, and she and I went to the new facility. We explained all about Lori, the problems we'd had at the first place. They said hallucinations and blindness were no problem. They could take care of her, and they assured me that she would be fine. What I didn't know then was all the paperwork from the first facility said bipolar. Nowhere in the paperwork did it say Hashimoto's, except for the paperwork that I had done. 9 days after she was admitted, I got an email from the nurse, and she said that they were requesting a consult with a psychiatric nurse practitioner for Lori's behavior. I had been there every day. Nobody had ever talked about her behavior. She lived with me for 6 years. I truly know her behavior could be tough sometimes, but nobody had ever said anything. I told the nurse that was fine if they wanted to do the consult if they were having behavior issues, but that I did not want her medication changed, that she had a psychiatrist at that point. By then, she had 2 neurologists, and that they would handle any medication changes if they were needed. The nurse came in and changed her medication, the ones she'd already been on, and put her on 3 strong psychotropic drugs. Before the first dose was given, I saw the MAR and I said, I don't want her to have these drugs. And the nurse said it didn't matter what I wanted. I was her POA, but it didn't matter. By the next day, after 2 doses, Lori could hardly speak and she couldn't eat. I pleaded with the nurse to stop the meds. She wouldn't do it. I emailed the administrator because there nowhere in the facility was it posted. I knew the name of the doctor, but there was nowhere it was posted of how to get in touch with the house doctor. And they said she was the only one that could stop the meds. The administrator didn't respond. The next morning, I got a call that Lori had fallen and she was really agitated. So I went to this facility, and while I was there, Lori fell out of her wheelchair and hit her knees. The nurse that wouldn't help me offered an ice pack. I said, no, I want to go to the emergency room. So they called the paramedics, and we were taken to the local emergency room, where they found acute and chronic brain bleeds and a shift to the midline of her brain. We were transferred to a trauma hospital, and Lori died 43 hours later. HE is a horrible disease with a myriad of changing symptoms. HE did not kill my sister. The medical professionals labeling her behavior as boxes they understood, rather than listening and seeing Lori for who she was. That's what took her from us. I advocated for Lori almost all of her life. As I said, she lived with me the last 6 years. The hardest part of her death has been that in spite of all my advocating for the efforts to find the best care possible for her, I couldn't protect her from the actions of those who were trusted to care for her. Now the state of Virginia is investigating the 3 nurses involved in the 2 memory care centers to ensure that this does not happen to anyone else. The Englishman G.K. Chesterton said, "It isn't that they cannot find the solution, it's that they cannot see the problem." I trust that after today, you'll not only see the problem, but also the person. Thank you.